Welcome back. Well, you probably know someone who has the flu or is recovering from it right now. The CDC says it's been a very active season for the virus. According to recent data, 46 states are seeing widespread flu activity. It's been classified as high in 26 states. As for here in Hawaii, the state health department says flu is at a moderate level. It says the best way to defend yourself is by getting the flu shot. Now, this morning, John Schaefer, Employee Health Coordinator at Adventist Health Castle, joins us to break down some flu facts. Good morning.
Hey, good morning.
Thank you so much for joining us.
Yeah, absolutely.
Okay, so for those who don't know, of course, we've all heard of the flu, but what exactly is it, and can it be dangerous?
Well, the flu is a virus, so it isn't a bacteria. You can't use antibiotics against it, and it primarily will go for the lungs. So when you have complications with the lungs, it can be very serious. And the CDC estimates between 2,000 to 50,000 deaths per year from it.
Wow, so very serious.
Yeah.
And what about this year? We were talking about how it's very widespread across the nation, moderate levels here in Hawaii. What have you guys seen at Adventist Health Castle? Yeah,
right now, I was checking with our infection preventionist, and almost half the patients on our units have the flu. Wow. So it's a really high rate right now.
Okay, and how does someone contract the flu then?
You can contract the flu from being around someone that has the flu. The CDC's even done studies that if someone has the flu and they leave the room, the virus can stay in the room for up to 8 hours in the air. So just breathing that air can give you the flu.
And that's probably why the numbers are so high and why it's so prevalent. Right. When it's there, it kind of lingers.
Yeah, exactly.
So what then would be the best way to prevent getting the flu?
Well, the best thing is preparing your immune system, and that's going to be first and foremost getting the flu shot, making sure you have that. Then secondly is getting enough sleep, eating healthy, washing your hands, all those immune system boosting things you can do.
And a lot of people now are hearing, oh, this year the flu shot isn't as effective. Is that true? And does that warrant a reason not to get it, or should you still get it anyway?
The nice thing about it is some of the earlier studies from the CDC that are coming out is, like for healthcare workers, they're estimating it's about 80% effective, which is way higher than the lower percentages in the past. And then for the community, we're seeing much higher rates of success this year as well.
Okay, that's good to know.
Yeah.
So then for the vaccinations, who should get vaccinated, and is it too late to get your vaccine now?
Right. Anyone that can get vaccinated, get vaccinated. It's going to be that best defense system for you. And no, it's not too late. We have the high rates going on right now. It does take a little bit of time for your immune system to build up to fight off the flu, but if I hadn't had my flu shot, I'd go get it.
Okay, and for those who maybe don't know, if you want to get vaccinated, where can you go?
Yeah, there's lots of spots you can go. Talk with your main doctor first. They usually have them ready and available. You can also go to any of the stores, Costco, Safeway, all that. They all have the vaccines there as well.
Okay, good to know. And then, we were talking, and we've talked about this before, but there are also a lot of myths associated with getting the flu shot. What are some reasons that people don't get the flu shot? And what do you have to say kind of in reaction to some of those?
Well, it's a needle. Who wants to get poked?
Yeah.
No one wants to get poked. But it is hard giving flu shots during the time when kids are coming back in school because illnesses are at a rise at that time as well. So someone may get the shot and then a few days later feel sick. It could be from the flu shot, just your immune system working, or it could be that you were exposed to something else at the same time.
And would have been getting sick anyway.
Yeah, exactly.
Okay, interesting. Good to know. Well, thank you so much for these awesome flu facts. And again, if you haven't gotten your flu shot just yet, it's not too late.
That's right.
Never too late, right?
Yep, that's right.
All right, awesome. Thank you so much,
Thanks.
John, for joining us again.